I became involved with obesity prevention about 15 years ago, in 2004, when I worked at the Institute of Medicine in Washington, D.C. I staffed several expert committees that were convened to advise the government on how to address the growing childhood obesity epidemic in the United States. During that time I was there, I staffed 3 National Academy of Medicine reports. And while there have been a lot of efforts around the country in the 15 years to address obesity in adults and children, about 2/3 of adults are overweight or obese, and about 1/3 of children are overweight or obese, we haven't halted or reversed that problem. We've made some good efforts, but we still have a lot of work to do to transform our culture, policies, environments, and systems so that they're healthy for everyone. My thinking about obesity and how I frame problems are much more holistic and multi-sectoral and global, from the people I've worked with in the US and other countries who've influenced how I think about it within the context of other global public health and public policy challenges. I attended the first Southern Obesity Summit in Little Rock, Arkansas in 2007, and at that time I was working at Save the Children in Washington, D.C., and partnering with Tufts University. We were adapting a childhood obesity prevention intervention to 4 states. 3 of them were rural states, to see how we could use a community-based approach to do that. I was very struck by just the breadth of expertise that was convened by the summit and the importance, because the southern states face really what some people call a triple whammy, which is food insecurity, poverty, and unhealthy environments that lead to obesity. So we really need some solutions and innovation that people can share across these states. I became involved with the Lancet Commission in 2016 because I knew the 2 co-chairs. One was Professor Bill Dietz. He was at the CDC and now he's at George Washington University. Also my former PhD supervisor from Australia, Boyd Swinburne, who's now at the University of Auckland in New Zealand. We're co-chairing this commission. They convened 43 fellows and commissioners across 15 countries to work on this report for 3 years. And it became clear to them that we couldn't just focus on global obesity, which they had done in 2 previous reports. We really had to look at how to address obesity within the context of other wicked challenges going on, undernutrition that affects about 800 million people around the world, overweight and obesity in children and adults that affect about 2.5 billion people, and climate change that affects all 7 billion people around the world. So we came up with a new term called the global syndemic, which is basically 3 very wicked challenges that are occurring in time and place together. And this became the Lancet Commission on the global syndemic, and not just on global obesity. It became clear at the first meeting that was in Washington, D.C. At George Washington University in 2016 that this commission could not focus on how to address global obesity without taking into consideration the challenges of undernutrition in many countries around the world, as well as climate change that's affecting everyone. There's common drivers to these 3 problems, and so they developed over that 3 years triple duty action recommendations that could be implemented at multiple levels to really address all 3 challenges simultaneously.